Researchers in Montreal are using artificial intelligence to design COVID-19 vaccines. And listen to this, they're doing it from their own homes using a process called reverse vaccinology. The team is breaking down the virus structure to find cost-effective options for a potential vaccine. Gilles Pellert from Concordia University is leading the Canadian side of this project. He joins us this morning. Great to talk to you today.
Thank you. Good morning.
Okay, what does it mean, Gilles, to break down the virus, and why is that so important?
Well, I mean, we're doing really fundamental research, ahead of the synthesis and actually trying the virus. So I should mention from the outstart that this is an international collaboration, which was enabled by two very talented Indian researchers who came over from China with research awards from MITAX, which is a Canadian innovation organization. And these two researchers brought their own expertise in cancer research and reverse vaccinology, which combined with the tools that they came to our research center at Concordia to learn how to perform large-scale computer simulations. This is what really enabled us to come up with vaccine solutions developed on the computer using modeling and simulations.
So you mentioned the international component. Your team is from all over. At what stage are you guys at right now?
So right now we've been able to design a number of potential vaccine solutions on the computer using the tools of reverse vaccinology and artificial intelligence, as you mentioned. And our international partners have been able to synthesize some of the lead compounds that we came up with. And we're in discussion at the moment with Canadian partners, potential Canadian partners, to conduct the biological tests and preclinical animal model trials.
You know, the most people that we talk to that are in the process of trying to develop a vaccine, they're working in labs. You're working from your house, like out of your home. How does that even function? What does your day look like, and what does your home lab look like?
Yeah, this is one of the advantages, I would say, of our field of research, is that we're performing all of our research on computers. And so we can, on a daily basis, we use our laptops or desktops to connect via stable internet connections to supercomputer facilities, either at the university or across Canada as part of the Compute Canada infrastructure. And we can perform all of our simulations remotely and visualize our results locally and interpret our data locally on our computers. So it's really, this line of research really lends itself well to working remotely, especially in these times of pandemic.
What are the biggest challenges you're finding working remotely?
Well, probably the lack of direct interactions with the researchers. It's a bit harder to have very productive scientific exchanges just online. But aside from that, we're used to work remotely.
And I want to ask you quickly about a timeline. What are you anticipating?
So, as I said, we were discussing with Canadian partners the fate of our preclinical trials and biological tests, and hopefully this will be done by the end of the year. And if these preclinical trials are passed successfully with at least some of our lead vaccine solutions, then there will be clinical trials toward the end of the year or next year. But this is really, the timeline for clinical trials is outside of my area of expertise, so I wouldn't be able to predict exactly when that would be done. Yeah.
Well, we appreciated your expertise this morning, Gilles. Great to talk to you.
Thank you. Same here. Thank you for having me on the show.
Have a good day.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.